Welcome back. April is Alcohol Awareness Month, and according to the National Institute of Health, alcoholism is a growing problem for older adults. Joining us now to talk more about this and also the resources available to help people struggling with addiction, we have Dr. John Dyben here, the Chief Clinical Officer at the Hanley Center. Welcome. Thanks for being here.
Thank you for having me here.
So, when we're talking about older adults, what age group are we focusing on?
The research and the data we have looks at adults 65 and older. Now, as an aging American myself, right, that gets more and more uncomfortable, but that's generally where the research is looking, 65 and older.
And what did this research find when it came to this population and alcoholism?
So the National Institute on Alcohol and Alcohol Abuse, they do a lot of research on an annual basis. The last we have is 2024. And what we find is that when you look at adults, American adults over the age of 65, it's about 50-50, about 50% are using alcohol on a regular basis, but there are about 3 million, roughly, American adults over the age of 65 that right now would meet criteria for alcohol use disorder at some level.
And what does that criteria look like?
So that's when, most American adults use alcohol, drink alcohol at some level. But it doesn't cause problems in their lives. When alcohol or any other drug use begins to cause problems in your life, then you meet criteria for a substance use disorder. So what that means is that around 3 million American adults over the age of 65, their use of alcohol specifically is causing problems in their lives. And there's a lot of different ways to look at that, but it could be that it's causing or exacerbating medical problems, physical health problems, problems in relationships. 65 is still pretty young.
Yeah.
So at 65 or 70, many of us are still working and still actively involved in the community. So when your use of alcohol begins to pull that away from you or cause problems in any of these areas, that's when you meet criteria for an alcohol use disorder.
Doctor, you were talking to me about alcohol-related dementia. What is that?
So, I hate to give the bad news, but the research is pretty clear that alcohol is not a health food, and actually it is a toxin in the brain. And so for some people, especially if there's been heavy alcohol use over a long time, we see older adults develop an alcohol-related dementia. And that becomes really complicated because if I'm in my 70s, for example, and I have signs of dementia, people tend to think that older adults don't have addiction, which is a myth. It's not true. And so people tend to automatically think of any dementia symptoms as being related to Alzheimer's or something like that. But what we find when we treat older adults is that there are a number of older adults who will develop alcohol-related dementia, and when you take away the alcohol, that dementia clears up.
All right, let's talk about what you guys are doing over at the Hanley Center and also what signs and symptoms maybe family members can look out for when it comes to their loved ones.
Absolutely. So with Hanley Center, and people don't know this, but right here in West Palm Beach, was the first ever residential program to treat older adults with addiction in the United States. And we've been treating older adults for decades now. And when you're a family member, if you start to see things like the doctor is telling your loved one to cut down drinking and they're unable to, or you're seeing that they are more impaired than they have been in the past. One of the things, as we age, our bodies change, and alcohol has a more significant effect on us. But also, when you're seeing signs of dementia and there's heavy substance use, consider talking to an addiction professional as well as other doctors just to rule that out. So anytime you see somebody beginning to have problems in their lives caused or exacerbated by alcohol use, or if you see dementia or those types of signs that you can't otherwise explain and there's a lot of alcohol use, talk to an addiction professional. And
doctor, I'm getting the wrap from our producer, but I have one more question. I'm so sorry. Really quick, why do you think we're seeing this trend in people 65 and older?
I think there's many reasons, but a big part of it is that the silver tsunami is the baby boomers are now coming into this, being the older adults, and they had a very, very, very different perspective on alcohol use and drug use in general than the previous generations, and so it is just more accepted accepted and more socially part of what it means to engage as an older adult today.
All right, thank you so much for all this information. If you want to watch this interview to learn more information about the Hanley Center, just head to our website, WPBF.com.